combination of Q switch 1064 nanometers fractional lasers and 1540 erbium glass fractional laser for Asian skin.
Yes, thank you. Thank you very much. Good afternoon, everyone. I'm Dr. Geyl Vitas, and for this afternoon's demo, we have a 43-year-old female who complains of uneven texture, some acne scars, and some uneven pigmentation. She's a baker, so she desires to have significant results, but with minimal downtime because she's very busy, right? And she's constantly exposed to a lot of heat, and she really doesn't want to have downtime because she has to be at her shop every day. So for our purposes today, as mentioned by Dr. David, I'm going to demonstrate a machine that has both a Q-switch and the 1064 nanometer laser and a 1540 erbium glass laser. So that would be the Clear Lift and the Clear Skin Pro. So let's put our patient down. So the goals of our treatment should be improving the skin quality as a whole. So not just texture, not just tone, but also maybe acne scars and even skin laxity. So I know she looks young, but she's already 43, and it will definitely benefit her if we target all depths of the skin. So I'm going to start with the Clear Lift, which is a Q-switch Nd:YAG 1064 nanometer laser. So this one comes in a fractionated tip, and it creates injuries in the dermis. So you can actually, sorry, I need goggles. After thoroughly cleansing our patient's skin, I normally divide the area of treatment into 3 to 5, depending on the size of the patient's face. So since our patient's face is not big, usually one cheek would be one area, the other cheek would be another area, and the forehead would be another area. So for her, I plan to use 2 depths. For those of you who have the Clear Lift, you know what I'm talking about. So I'm going to use the -1, which is, it goes a little deeper, and then the 0, which goes a little more shallow. And then I plan to deliver 3,000 millijoules all over the treatment area. So I'm going to start with, okay, hold on.
Dr. Uren, can
Yes?
I ask, our target in this patient is for minor wrinkles or
for
color or freckles or something?
Yeah, our target, Dr. David, is skin rejuvenation and shallow atrophic scars. So I'm going to do 3 hertz, and I want to deliver 18 millijoules per pulse. So I'm going to start with the right cheek. So it's a very easy procedure to do, and it's very comfortable. Normally, the patients feel slight warm tingling sensation. And as you notice, I did not have to apply any topical anesthesia prior to the treatment because it's very comfortable. Patients actually don't feel much, but after the treatment, if you ask them to touch their faces, they would feel a little bit of warmth. Some patients who are a little bit on the sensitive side, or those with lighter skin types, may notice a little bit of redness. But other than that, it's a very comfortable treatment. As you can see, our patient is almost falling asleep. Just kidding. Yeah, so normally, so the machine will tell you how much energy you're delivering, and I've already delivered almost 300 on this side. So normally per grid or per area, I like to deliver 800 to 1,000 cumulative energy, and then with a cumulative energy of about 3,000 depending on what the patient needs. Okay, so I'm done with that. I'm going to go to the forehead. And depending on what you prefer, you can actually customize it a lot. I like to deliver the same depth all over the face before I change tips. It's just easier. Some like to treat it per grid. That's also okay. It really depends on what you want. So I like using 1800 millijoules on patients with this kind of skin type. It takes a longer time, but I think it's safer.
Dr.
Sometimes,
Irene,
yes,
Dr.
doctor?
Irene, now you are using 1064 fractional.
Yes, that's
So,
correct.
and you just count on the total shot, total energy, or you see you are going to see the end point.
I base it, doctor, on the amount of energy that I deliver. So it shows it here on the screen. Maybe we can focus it on the screen. There, it's on the upper right top. So now I've already delivered 700, and I'm going to move now to the cheek, the other side. So it's quite fast. You may opt to just do this treatment if you want, especially if your patient is just in for a skin rejuvenation treatment or a pick-me-up treatment. You don't really have to combine it, but I find that in patients with a lot of texture irregularities, scars, and even acne, the Clear Skin Pro really gives a lot of added benefit, and patients come out happy. So with the combination treatment, you can do it every 2 to 4 weeks, depending on what your patients need. Some of them have like events to attend and they want faster results, whereas others, can wait. So now that I'm almost done with treating the patient using the -1 tip, I can stop the machine and then change it. Just pull it. It's very simple with the 0 tip. So I'm going to do the exact same thing. I'm going to ask my patient to
Dr. Eric, can you tell us the focal depth of the spacer?
This one is 0.
0. Yeah, so it's in the surface.
No, it's in the middle, Dr. David, because there's 2 other tips, the +1 and the +2, and those are more shallow. But since I'm going to do the Clear Skin Pro treatment, which is an erbium glass, I chose to use a handpiece that goes deeper, a tip that goes deeper, so that I can treat more layers with the 2 handpieces.
So handpiece 0, it is 0, it means below the surface.
Yes, that's correct.
Thank you.
And normally, Dr. David, when I'm treating patients with darker skin types, I don't like using the +2. I mean, it's okay, you can, but that's just a personal preference. I prefer using
So
0.
+2 is mean more superficial?
Yes, that's correct, Yes. Yep, so now we're at 1-3, and how are you? She's good, she says she's good. You can't hear her, but she's okay. Do you feel any discomfort? No? So when you're doing the treatment, the patient can sort of hear like a clicking sound, especially as you go more shallow, but it's not really painful. So this is at 3 Hertz repetition. And the tip has to be touching the skin so that you get the right depth. If you actually lift it, it will make noise and it might scare the patient. Okay, now that we're done with treating the whole face with a clear lift, if you touch the face, it's a little bit warm. There's a little bit of redness, but it's not really so much. So now, I'm going to change the handpiece to the Clear Skin Pro, which is an erbium glass 1540 nanometer laser. So the erbium glass 1540 nanometer laser has an affinity to water. So the target chromophore is water, but it's not as strong as your erbium YAG or your CO2 that it doesn't cause ablation of the skin. So it's actually a very good treatment to do on patients who desire skin rejuvenation, improvement of scars, but without the downtime or wounds after. So for our patient, she complained about atrophic acne scars and skin rejuvenation. So I think it's a perfect wavelength to use on her. This Clear Skin Pro actually also comes with different types of hand pieces. So we have the focused tips in 10 millimeters and 4 millimeters and even a 2 millimeters spot size. And it comes with a vacuum tip and a cooling tip. So usually on my patients with active acne, I like to use either the 4 millimeters focus tip or the 10 millimeters focus tip with vacuum. On my patients with acne scars or chickenpox scars, I also like to use the focus tips. But for our purposes today, since our patient wants like skin rejuvenation for her entire face, as well as targeting atrophic acne scars, I'm going to use a 7x7 pixel tip with a cooling tip. So for those of you who already have the Clear Skin handpiece, the advantage of the Clear Skin Pro is that it has a higher peak power, which equates to significant benefits and better results. So for our patient today, I'm going to deliver 2,000 millijoules per pulse at 2 hertz. So if you want to deliver higher energy, you can lower the repetition rate and you can deliver up to 3,000. So I just want to give her, 2,000. There. So it's very cold and it makes for a more comfortable treatment. So again, I'm going to start on the right cheek and I'm going to deliver, I'm going to do 2 passes. I'm going to start. So you don't, did you get surprised? What the patients feel actually is heat, slight, how do you say, tingling heat sensation, but it's not really painful. So normally on patients with darker skin types, I usually use about 2,000 to 2,500 millijoules per pulse. And I do 2 to 3 passes depending on what the patient needs. So for this one on my patient, right now, she doesn't really have very deep scars, just some atrophic scars from probably previous acne. So this would be a good enough treatment for her. So with the 40 nanometer erbium glass laser, it creates columns of coagulation that triggers collagen remodeling. So this is actually very good for patients who desire skin rejuvenation and collagen remodeling without the downtime. So the combination of the Q-switch 1064 fractional laser treatment in this with a clear lift in this 1540 nanometer erbium glass treatment with a Clear Skin Pro is actually beneficial if you want to target several layers in one treatment. So I'm done with the 2 passes on her cheek. How are you? No pain? Yeah. So there's a little bit of warmth and a little bit of like tingling sensation that you feel, right? But again, with this treatment, there's really no need for topical anesthesia because it's not really that painful. And usually after the treatment, I just advise my patients to avoid, direct heat and direct sun exposure for about 1 to 2 days. Some of my patients, they turn a little bit red and pinkish after the treatment, but other than that, they can go about their daily activities. Some of them even go to dinner or lunch with their friends, and there's no downtime and you don't really notice anything. So the advantage of having a platform with a lot of lasers is that when a patient comes to you with a lot of concerns, you have a lot of options. So on my patients with acne, this is also very helpful because I can treat individual lesions because the 1540 nanometer wavelength targets the sebaceous glands, and it also reduces bacterial proliferation. So we're lucky that our patient today doesn't have acne. It's also beneficial to shorten the treatment time on your patients who want to address several skin issues. So I'm now on my last pass using the Clear Skin Pro. And again, if you touch the patient's skin, it will feel warm, but there's no open wounds. It's a non-ablative laser surfacing, and it's quite comfortable, and it's fast. So you can see my time slot is 20 minutes, and I completed the entire treatment. Okay.
Dr. Erin, and
Yes,
how
doctor.
about the pain level? Does the patient need topical anesthesia?
No, we did not apply topical anesthesia on the patient because the sensation that she would feel is only like warm, tingling sensation, but there's practically no discomfort and no pain.
And for your patient, do you
Are you okay?
do the skin conditioning before treatment?
For my patients, Dr. David, with dark skin, I always pre-treat with sunscreens at least and lightening agents. This is to ensure that we minimize the risk of post-inflammatory hyperpigmentation, especially on patients whom, like the habits and lifestyle, I don't know yet. It also, I think, in my opinion, tests their compliance for post-treatment. I mean, if they're able to follow the pre-treatment, I'm almost sure that they can definitely follow my post-treatment.
Thank you.